Welcome to section 8.6, where we're going to talk about bones of the thoracic cage. So in our thoracic cage, we have a bony framework for our chest. It's going to consist of our thoracic vertebrae posteriorly, our ribs laterally, and the sternum anteriorly. This helps create a protective enclosure around our thoracic organs we're going to have here, such as the heart and the lungs. And these bony structures will serve as attachment sites for many muscles. Our sternum is known as our breastbone and is a flat bone that forms the anterior midline of our thoracic wall. This portion over here is our manubrium, which is the widest and most superior portion of our sternum. We do have two clavicular notches over here that will articulate with the sternum with left and right clavicles. Then we have our suprasternal notch, which is right over here. This is also known as your jugular notch, and it's just a shallow superior indentation between those clavicular notches. We have our costal notches, which you could see along the sides of the body of the sternum over here. These are articulations for first ribs costal cartilages. As I mentioned, we have the sternum body over here, or gladiolus. This is the longest part of our sternum and has the costal cartilages attaching to it from ribs 2 to 7 at the costal notches. And we're going to see that it articulates with the manubrium at the sternal angle. Our costal cartilages of the second ribs also attach here. So as we've said before, the angle helps identify rib number 2, which is going to be an important landmark for palpation and counting ribs. Most inferiorly here, we have our xiphoid process. This is at the very tip of our sternum, and it doesn't ossify until age 40. Now for a clinical view here, sometimes people can have a sternal foramen. This is present in the midline of 4 to 10% of adults, and it's a failure of the left and right ossification centers to fuse completely. It may be misidentified as a bullet wound. Patients that have a sternal foramen can have instances that can lead to fatal injury in the pericardium, the serous membrane covering the heart, or it could lead to injury of our right ventricle of the heart, the aorta, or the lung, depending on where the location is of the foramen. Now for our ribs. These are going to be elongated, curved, flattened bones that are originating on the thoracic vertebrae. They end in an anterior wall of the thorax, and we have 12 pairs of these ribs, and we can classify them as being true ribs, false ribs, or floating ribs. True ribs are ribs 1 through 7 that connect individually to the sternum by cartilaginous extensions that are termed costal cartilages in here, and the smallest true rib is going to be our first rib. Our false ribs, seen in purple here, are going to be ribs 8 through 12. Our costal cartilages here are not attached directly to the sternum, and costal cartilages ribs 8 through 10 are going to be found, whereas our ribs 11 and 12 do not have any costal cartilages. And therefore, we also call ribs 11 and 12 floating ribs. If we look at our rib, we can see the vertebral end of the rib is going to articulate with our vertebral column. So we can see the head here is articulating with the body of the vertebrae. Our head can be divided into superior and inferior articular facets, which are placed over here, and articulate with the facets or demifacets of those thoracic bodies. It can be divided by an interarticular crest as well, which you can see in between that superior and inferior facet. The neck of the ribs lies between the head and the tubercle, and our tubercle over here is going to have an articular facet that is going to articulate with the transverse process of thoracic vertebrae, specifically at the transverse costal facet. The angle of the rib is going to be the site where a tubular shaft begins to curve. And if we look at the inner portion of our rib, we can see a costal groove in here that is going to mark the path of nerves and blood vessels. Sometimes in a clinical view, we can have a rudimentary cervical rib. This may form from the 7th cervical vertebrae, and it may compress, which could be seen over here, it may compress the artery and the nerves extending towards the upper limb, which could produce tingling or pain. Sometimes individuals are lacking a pair of the 12th rib as well, and we can also see instances where we have fused ribs, like over here, or a bifid rib, where we see a split into two portions when it reaches the sternum.